Aloha and welcome to the 2020 John A. Burns School of Medicine virtual white coat ceremony. Good morning, I'm Dr. Karen Thompson, Professor and Chair of the Department of Pathology at the John A. Burns School of Medicine, or JABSOM. It is my great honor to serve as your Master of Ceremonies today. We welcome you to the first and hopefully the last virtual white coat ceremony. We will miss seeing our incoming students on stage and witnessing them being cloaked by JABSOM alumni or their mentors, but this in no way diminishes the enthusiasm and the joy that we feel in participating in this most significant rite of passage and welcoming the JABSOM class of 2024 into the profession of medicine. This event is an introduction of new students, an act of acknowledgement of several people, and the commencement of a commitment to service. Dr. Kalani Brady, Associate Professor of the Department of Native Hawaiian Health at the John A. Burns School of Medicine, will lead the program with the chant, Oli Komo.
Ko nui ko iki ko loa ko pako ko aho ko loko ko amamau no na kawakau.
Ko nui ko iki ko loa ko pako ko aho ko loko ko amamau no na kawakau.
E ko mai ana I ka aina e uluhua ne.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
E ko mai ana I ka wai e hu a e nei.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
E ko mai ana I ka vai o ke kai.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
E ko mai ana I ka lani nui a kea.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
E ko mai ana I ka hana pono o ka poe e.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
E ko mai ana I ka mana hokau like bale e.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
Ko nui ko iki ko loa ko poko ko waho ko loko ko amamau no na kawakau.
Mahalo, Dr. Brady and students. We would like to recognize the Friends of the Medical School, the Hawaii Medical Foundation, the JABSOM alumni of the class of 1970, and United Health Partners for their generous donations of time and resources to help us with today's event. Mahalo to the many individuals who have made donations for our ceremony today. We thank all of you for sharing in this very special event. Distinguished and honored guests, parents, families, current students, respected faculty, alumni, my esteemed physician colleagues, and most of all, our guests of honor, the students of the John A. Burns School of Medicine, class of 2024, aloha and welcome to our JABSOM Ohana. Today, with the support of our community partners, Queens Health Systems, Hawaii Pacific Health, and Kaiser Permanente, I welcome you to the white coat ceremony for the class of 2024. The more than 4,000 alumni of this medical school since its first graduating class in 1975, together with the graduates of its residency training programs, comprise the majority of practicing physicians in this state. JABSOM physicians are expected to give medical care, to provide healthcare leadership, to conduct research, and to educate in service to Hawaii as well as to the nation at large. We welcome these future physicians to this community today with the expectation that they will learn well and practice compassionately as caregivers to all of us. It is my pleasure to introduce to you the Dean of the John A. Burns School of Medicine, Dr. Jairus Hedges, who will offer welcome remarks.
Welcome. I'm Juris Hedges, Dean of the John A. Burns School of Medicine, and we are doing this white coat ceremony virtually this year, but I really appreciate you participating with us and hearing some of the important messages that we give to our entering students each year. Normally we do this after the first week of medical school is complete. Now we're doing it after about 1.5 months of exposure, but the messages are very similar. This is a welcome to the profession, and it's important that our students see this as a calling and a true profession. And as family members, those of you watching this with your children who are now students at John A. Burns School of Medicine, you will, of course, be some of the first patients that these students will see and work with. Just give you an example from my own background. My father had a heart condition, had a heart murmur that I was aware of even before beginning medical school. And he was also quite limited in what he could do because he could not exert himself very actively. And although he worked 2 jobs to keep things going for the family, he also was not able to do anything with significant exertion at any one time. And as I progressed in my medical studies, I realized that he was suffering from advanced cardiac heart failure and needed a new heart valve, which at that time was a fairly new phenomena. And as the only one with medical knowledge in my family, I had to work with local practitioners, find those who had some knowledge about the availability of heart valves, and get him into treatment so that he could be cared for. And so learning to manage conditions in one's own family really brings home the importance of what one has to do as a physician. In the case of my father, it was expected that he probably had another year or 2 to live with his failing heart. But with the new valve, he was able to get an additional 30 years of life. And that's the sort of difference that we can make as physicians. And it's one of the reasons I like to speak about the kuleana that our young physicians in training have. Kuleana, of course, represents both privilege and responsibility. Each of the students in our class has great privilege. They now have the opportunity to learn a profession that can help them, help their family, and help their community. And it's the responsibility to do all of those things, to help keep oneself healthy, to keep one's family healthy, and keep the community healthy. That is the responsibility of a physician. And we have to undertake this as a profession, not for personal advancement, but really to contribute to the overall health of the community. Now, as you are aware, during this time of COVID, there is considerable risk to healthcare professionals. But I want to remind you that throughout the ages, physicians have had significant risks to their own health and to that of their families. And they've seen that as part of their responsibility to mitigate that risk, to take precautions, but not to shirk from their duty to deliver care and to minister for those in need, whether they can be cured or whether it is comfort that the patient will benefit from. So I encourage you as family and the students who are being recognized in this white coat ceremony to realize their kuleana, that it is really important that we not shirk our duty, that we not look for ways to avoid meeting patients, working with patients, but rather we look for ways that we can do it to help our patients and do it such that we protect our families and ourselves to the greatest extent possible. But there is always risk in being a physician. And it's important that all of you or supportive of those who are learning and appreciate the effort that they will put into this profession, and that they in turn give back to the community and to their families all of the care that they possibly can, because Hawaii needs these practitioners. So thank you for being here today. Thank you for being a part of this welcoming ceremony. And we're very proud of these young physicians in training. Mahalo.
Thank you, Dr. Hedges. The originator of the white coat ceremony, Dr. Arnold Gold, the founder of the Arnold P. Gold Foundation, writes, "On each white coat student received is a gift from our foundation, a pin bearing our logo, a golden Mobius loop symbolizing the continuous bond of trust, respect, and communication that connects healthcare professionals with their patients." You may not be able to see it, but mine is over here. He hopes that you will continue to wear this pin as a daily reminder of this morning's ceremony and of the pledge that you make as you enter into your professional life as a physician in training. He sends congratulations to each of you and to your families. Students, on your white coat's left lapel is a pin with the JABSOM emblem. This pin is worn with pride by our JABSOM faculty and alumni. This pin welcomes you to the JABSOM larger ohana. Finally, we would also like to thank our scholarship donors for investing in the future of healthcare in Hawaii by providing support for our medical students. At this time, it is my pleasure to introduce this year's keynote speaker, Dr. Royce Shimamoto. He currently serves as a clinical faculty member in the Department of Medicine at the John A. Burns School of Medicine. Dr. Shimamoto was selected by the graduating JABSOM seniors who were inducted into the Gold Humanism Honor Society, or GHHS, to receive the 2020 Leonard Toe Humanism in Medicine Award, presented by the Arnold P. Gold Foundation in recognition of his commitment to compassion and sensitivity in the delivery of care to patients and their families. The title of his keynote address today is Curiosity, Empathy, Connection.
Dean Hedges, fellow faculty, friends of the medical school, honored guests, family, friends, and the incredible class of 2024. It is my honor to speak to you on this very special day on behalf of the JABSOM Gold Humanism Society. This is an impressive ritual, the white coat ceremony. It is the beginning of your journey towards becoming a physician. You are all going to be great physicians. This is the tradition at JABSOM. The students that want to go to JABSOM, get into JABSOM, and graduate from JABSOM are a diverse group of hardworking, high achievers who are best known for high quality care that is provided with great humility and compassion. The white coat is not merely a garment that protects us from stains. It is a symbol of our profession. At the heart of our profession and everything we do is humanism. For me, humanism is the blend of curiosity and empathy that leads to a deep connection. The humanistic practice of medicine is taught at JABSOM. It requires as much work as passing the USMLE exams and the board certification exam. So how do you practice humanism? It starts with curiosity, taking a moment to really get to know what is happening. Let your curiosity go. In your studies at JABSOM, you will spend significant amounts of time learning about organ systems, biochemistry, cell and molecular biology, pharmacology, and physiology. Dive deep. Use this time to really understand what is happening here. Let your curiosity take you to places and dig deeper than you have ever gone before. Empathy is the next important component of humanism. In today's digital world, it is important to remember we are not merely technicians. Each patient has a very dynamic interaction with their family and friends that love and care about them, and also their hopes and dreams. Armed with curiosity and empathy, you will be able to make a deep connection with another human being. As I reflect on humanism in my own life and practice, I am reminded of this example, the curiosity. So I have been caring for a patient in the hospital for over 6 months. He has end-stage renal disease and is on hemodialysis treatment. He has persistent orthostatic hypotension, labile blood sugars, and he developed a significant complication while in the hospital, endocarditis. Really, what is happening here? Very, very curious. There was so much to learn, so many learning issues to pursue, so many problems to solve. We all had to work together as a team, consulting physicians, nurses, pharmacists, physical therapists, to a point where he doesn't get dizzy and lose consciousness, to get to a point where sugars rarely rise above 180, and to a point where his blood cultures now remain negative after completing a very long course of antibiotics. The empathy. So the question comes up, so what? He's still in the hospital because there was no place that will take on the challenge of keeping this patient safe. How very curious. We needed to learn more about community services, insurance coverage, more about care homes and the type of care they provide for patients, so that we can answer the question, now what? We will still need to take all the biomedical information that we've learned from him to adjust his treatments and prevent further complications. We will also continue to maneuver through the various systems in order to find a safe discharge for this patient. He has been through so much, been in the hospital for so long, and now with COVID-19, he has not had any face-to-face encounters with his friends or family in a very, very long time. The connection. So just the other day, when I went to round on him, I noticed he had a beautiful ukulele right next to him on his bed. He told me it was made of bamboo. It was a beautiful wood grain, light brown. He had an electric tuning device attached to the head of the ukulele. We started to talk. We talked for a while. He pointed to 4 other ukulele in the case on the chair next to his bed. He had been learning to play through lessons on YouTube. He was so excited to show me the whole new decals that made his ukulele very special. So despite all that had happened to this patient medically, despite the social isolation, he found purpose and excitement and joy. I was so glad I was curious that day. So glad to make this amazing connection with my patients. My challenge to you is to find humanism in all your interactions. Find it daily. Your classmates, teachers, and even strangers are a great place to start. Be curious with empathy, and you will find you will be able to make a deep connection to all those around you. The more you practice this, the easier it will become. When you develop a deep connection with your patients, you will be able to help guide them in a direction that best fits their needs and respects their values. This is the humanistic practice of medicine. I am so excited for all of you. This is one of the greatest challenges for all of us during these incredibly stressful times, to practice medicine with humanism. I wish you all good luck on your new adventure. Thank you so much. Bye.
Thank you, Dr. Shimamoto. This year is unique in so many ways, and as a way to address this year's class, the Association of American Medical Colleges, or AAMC, in partnership with the Arnold P. Gold Foundation, has put together an additional keynote address for you by Dr. Vivek H. Murthy, the 19th U.S. Surgeon General, and the 2020 awardee of the Vilcek Gold Award for Humanism in Healthcare, presented by the Vilcek Foundation and the Arnold P. Gold Foundation. Enjoy this special address by Vivek H. Murthy.
Greetings to the medical school class of 2024. To your families and friends, your significant others, to your faculty and deans. You begin medical school in a time of great chaos and uncertainty, which will only increase your roles as medical student and then doctor. During this historic time, we come together today to recognize the unwavering core of healthcare, humanism, our collective humanity, your humanity. The White Coat Ceremony was created in 1993 by the Arnold P. Gold Foundation to mark this moment in your journey as a physician, to recite an oath to recognize your awesome responsibility to the patient in front of you, and to emphasize the importance of compassion, respect, empathy, and ethical patient care.
This ceremony takes on special meaning as we continue to be in the grip of a global pandemic and dealing with the persistent and difficult racial inequities in our society. So in this context, your humility and your ability to see the humanity that is part of medicine is more important than ever. How clearly I remember when I first put on a white coat in early clinical encounters in medical school, how humbled I was that the patients assumed that I was knowledgeable and trustworthy, and how much I wanted to earn and realize those attributes. So I hope that as you go forward on your own individual medical journey, you will remember the importance of lifelong learning and the importance of humility and the importance of what is called a beginner's mind, an openness to all possibilities. So as your journey continues, I hope that you will maintain your humility and a beginner's mind, and I congratulate you and welcome you to the world of medicine.
At this critical moment in history, as we are dealing with an unprecedented pandemic, we are also called upon to address the sweeping xenophobia and racism that harm the health of so many and cut short billions of lives. And so it is particularly poignant that we introduce Dr. Vivek Murthy to present this White Coat Ceremony's keynote address. Dr. Murthy served as the 19th Surgeon General of the United States and is the best-selling author of Together, the Healing Power of Human Connection in a Sometimes Lonely World. Dr. Murthy also served as faculty member at Harvard Medical School and founded multiple nonprofit organizations. Dr. Murthy is the 2020 recipient of the Vilcek Gold Award for Humanism in Healthcare, which is a joint honor bestowed by the Gold Foundation and the Vilcek Foundation, recognizing extraordinary contributions of immigrant healthcare professionals. Earlier, Dr. Murthy received the National Humanism in Medicine Medal from the Gold Foundation, and he is the Gold Humanism Honor Society member. To the members of the medical school class of 2024, congratulations again on the start of your wonderful journey as physicians. Please welcome the keynote speaker, Dr. Vivek Murthy.
Congratulations, class of 2024. It is an honor to be with you as you begin one of the most exciting and consequential journeys of your life. When you first set your sights on becoming a physician, no one could have imagined that you would be joining the profession during one of the most surreal moments in our lifetimes. COVID-19 has transformed our lives. It has also underscored the important role that medicine and public health play in society, while also making it painfully clear that we have more work to do to create a system that cares well for everyone. COVID-19 has reminded us how much the health of a few affects the health of all. It has reminded us that poverty, racial injustice, and access to clean water and healthy food have profound consequences for our health, often more so than the decisions we make in clinic or the hospital. If we want to be healers in the fullest sense, if we want to not only treat disease and suffering, but also prevent them in the first place, then we must broaden our charge as physicians. We must care not only for the patient in front of us, but we must also seek to understand and address the underlying factors that drive illness in our communities. We must do this through our research, our teaching, our direct service, and our advocacy. There is one more thing this pandemic has reminded us of, a lesson that will be invaluable to you as you navigate the choppy waters ahead. It has reminded us how much we need each other. Our relationships are far more powerful and consequential than we may think. The more we study social connection, the more we realize that when we have people in our lives we trust and love, we are happier. We are also healthier. We perform better at school and at work. And we are better able to dialogue with one another, which has implications for reducing polarization and increasing cooperation. Our relationships, it turns out, are the foundation on which we build everything else. But as essential as our connections with one another are, they are often the first to suffer in our fast-moving world, where the pursuit of work and achievement often displace time with family and friends. I say that as someone who, for many years, allowed training and work to distract me from the people who mattered most, something I have worked hard to correct in recent years. Despite all the uncertainties and ups and downs you will encounter in the years ahead, my hope is that you will always make your relationships your top priority. Our relationships are our anchors. Keep them close. Fight for them. Pick up the phone when a friend calls, even if it's for 30 seconds. Visit your family and close friends, even if it's for a short while. Remember that even when you have only a few minutes to spend with someone, you can make that time count by giving them the gift of your full attention and your full presence. I leave you with one final thought. I want you to know right here and right now that the most important qualities you need to be a healer are the ones you had even before you entered medical school. Your ability to care deeply for others, your ability to listen with compassion, your ability to lead with love. Despite what the world may tell you, you are enough. You don't need to publish papers to be worthy. You don't need to receive awards or ascend to powerful positions in order to be a good doctor. It is in our intrinsic ability to give and receive love that we find our humanity and our true power to heal. I hope you are always surrounded by people who love you. I wish you many moments of laughter and joy in the journey ahead. May you have lives full of inspiration, full of peace, and full of happiness. Congratulations and good luck.
normal circumstances, alumna from the class of 1970 or a student-selected physician mentor or physician relative would cloak each student. However, due to the current conditions associated with the COVID pandemic, students received their coats last week. And at this time, I would like to recognize the contributions, accomplishments, and devoted service to their patients and the community of the JABSOM class of 1970. Students have also received a personal stethoscope as a gift from the Hawaii Medical Foundation. Dr. Myron Shirasu has a few words about the Hawaii Medical Foundation and its gift to each student, and these can be found in today's program. Students have also received a book entitled Quotable Ostler, presented by the Friends of the Medical School. The Friends of the Medical School have been supporting the White Coat Ceremony with their donation of books since 2002. Dr. Lucy Wong has a few words about the Friends of the Medical School and its gift to each student.
Welcome. I am Lucy Wong, President of the Friends of the Medical School and a proud JABSOM graduate. For the past 40 years, the Friends of the Medical School's sole purpose was to support the students, dean, and school. Imagine 40 years. I wasn't even born yet, or so I wish. The Friends created the Ohana Day, which occurred virtually last month, and helped to start this White Coat ceremony at JABSOM. I'm honored to represent the Friends and welcome you to the Ohana. Medicine is a science, an evidence-based science, but remember, there's also the art of medicine. Sir William Osler is considered the father of modern medicine, who emphasized the heart of medicine. An essential part of medicine is caring for the emotional needs as well as the physical needs of a person. Caring for a patient involves actually caring for the person. JABSOM strives to pass on these learnings, which is one of the many reasons this school is so special. The extra touch, which makes a good physician into a great physician. This gift, the Quotable Osler's booklet, was created with the help of JABSOM's Osler Society. It includes Osler's quotes with personal interpretations that were painstakingly written relating to their personal journey from fellow students, alumni, and faculty. This is a gift of experiences and learnings from friends. Enjoy.
There are two organizations which exist solely to support our medical school: the John A. Burns School of Medicine Alumni Association and the Friends of the Medical School. While only graduates can belong to the Alumni Association, the Friends of the Medical School membership is open to parents, grandparents, spouses, friends. It is a tremendous way to support each of these students and the medical school. New members are always welcome. The white coats that are the emblematic centerpieces of today's program were once called Cloaks of Compassion by Dr. George McKinney, JABSOM class of 1989. At this point in the program, we would have normally announced each incoming student and they would have received their white coat. However, this being an extraordinary year, we won't be able to do that, unfortunately. We hope that there will be another time in the future, hopefully in the near future, when this year's students can be cloaked in person. May I present the JABSOM class of 2024. And now it is my pleasure to ask Dr. Lee Buen Consejo Lum to lead the class of 2024 in the Hippocratic Oath.
JABSOM class of 2024, parents and family, esteemed guests and faculty, I am privileged to be here with you today, albeit virtually, to celebrate your entry into the profession of medicine. While this event has been altered due to the pandemic, it is no less important. In fact, your restatement of the Oath of Hippocrates in a few minutes is perhaps more important than it has ever been. The Hippocratic Oath was written in the 5th century BC and is one of the oldest documents in history. While the creators intended it to be a binding covenant, modern doctors see the oath as a promise to uphold the art and science of medicine and act in the patient's interests. As medicine and society have changed, physicians have changed the oath to accommodate these shifts. Several phrases are particularly important in this time when we see so much suffering in our state, country, and across the world. As medical students, if you can approach your studies and each patient and family by trying to see the world through their lens, through their histories, framework, and circumstances, this will help you better ministrate without discrimination and care generously and honestly. Patient confidentiality now includes social media, HIPAA, and many other protections in this increasingly digital world. Upholding the highest behavioral standards for yourself and your peers also includes wearing a face covering or mask when you're not alone, adhering to physical distancing guidelines, and if you are going to eat with others outside of your immediate household social bubble, you need to do so more than 6 feet away. Thank you in particular for adhering to these last 3 guidelines. But let's take a closer look at the definition of the word ministration. It stems from the Latin word ministrare, or wait upon. In English, it stems from the word minister, attending to the needs, providing, and being a servant. Indeed, medicine first and foremost is a service profession, and it is what you all said in your personal statements. My hope for all of you is that you not only develop into excellent physicians, but also servant leaders. We, as your teachers, pledge to help you achieve that. So now, please join me in restating the Oath of Hippocrates, which is in your program. I swear by all I hold most sacred and before my family, my teachers, and my peers, that to the best of my abilities, I will keep this oath and stipulation. To honor all who have taught me this art, and in the same spirit of dedication, to impart a knowledge of medicine to others. I will continue with diligence to keep abreast of advances in medicine and respect those who broaden our knowledge by research. I will treat without exception all who seek my ministrations, discriminating against no one, so long as the treatment of others is not compromised thereby. And I will seek the counsel of particularly skilled physicians where indicated for the benefit of my patient. I will remember that caring for the patient will be my primary concern, and while doing so, I will honor the autonomy of the sick. I will recognize that such caring requires my being available, giving my time generously, communicating honestly, and comforting as well as treating. Such care also involves offering my support to my patients' loved ones. I will maintain all patient confidentiality and uphold the highest ethical, moral, and behavioral standards for myself and my peers. My behavior will always be honorable, thoughtful, and reflect justice toward all humanity. My fiduciary role will require protecting patients from all forms of malpractice, malfeasance, and unnecessary expenses, and I will try to prevent as well as cure disease. While I continue to keep this oath inviolate, may it be granted to me to enjoy life and the practice of the art and science of medicine, respected by my peers and society. May my faith strengthen my resolve to attain the above. Thank you very much, and best wishes on your journey.
The Friends of the Medical School present an award for community contributions. Dr. Lucy Wong, President of the Friends of the Medical School, and Emmy Tamimbong Burns, on behalf of the Burns family, will present this year's award.
Judge James S. Burns, son of Hawaii's governors John A. Burns, for whom this school is named, dedicated himself to our medical school. He served on the board of directors of the Friends of the Medical School for years. And for years, he was a welcome fixture at this white coat ceremony, giving the charge to the newly clad student doctors. Upon his passing on March 9, 2017, the medical community felt his absence. To continue his legacy, the Friends of the Medical School has established the honorary James S. Burns Award in his name. Awardees will, in the image of Judge Burns, having demonstrated an outstanding, undying dedication to the betterment of the medical school over their lives. Awardees may be alumni, faculty, or community members whose contributions are of such a magnitude that we have no choice but to bestow upon them this highest award. We would like to thank Jim's family for their blessing in helping to establish this award, which we hope will endure for generations to come. Jim's wife, Emmy Tomingbang Burns, on behalf of the Burns family, will be joining me to present the awards. Our first awardee started her academic career by earning her associate degree from Leeward Community College. She went on to earn a bachelor's degree from UH Manoa and then a dual MD and MPH degree from JABSOM and the UH School of Public Health in 1979. She trained in internal medicine at Dartmouth Medical School, which was followed by a fellowship in geriatric medicine at Harvard Medical School. She was recruited back to Hawaii to become the first fellowship-trained geriatrician in the state and to create the first medical school education in geriatric medicine. Over the course of her impressive career, she has been selected to lead in a variety of capacities. She has served as CEO of USERA, currently called University Health Partners, JABSOM's faculty practice. She is the Associate Director for Administration and Chief Operating Officer for the UH Cancer Center. She has a long history of participating in the governance of multiple healthcare facilities in Hawaii. Dean Jairus Hedges commented, she is one of those quiet, admired leaders who is able to take on virtually any task which confronts her. She has served in many leadership roles from the medical school, cancer center, medical board, State Medical Association, and JABSOM's faculty practice. She was a pioneer in the field of geriatric medicine and continues to maintain an active practice while she has served in many leadership roles. She is a Renaissance woman who brings great value to all she leads. But it is her dedication to educating our physicians that she has truly shined. She is well known by students and residents for her tireless teachings and steadfast guidance through their training. She has taught generations of medical students and residents. It is for her generous dedication for the betterment of the medical school over her superlative career that the Friends of the Medical School hereby bestow the honorary James S. Burns Award to Dr. Patricia Blanchette. It is difficult to imagine a physician more well known to more generations of JABSOM's graduates than our next awardee. He came to Hawaii 50 years ago to start practicing medicine and to begin a lifelong dedication to the betterment of our medical school. He has practiced in various settings, including the VA, Queen Emma Clinic, and his own private practice. And in every venue, he has taught medical students with uncommon dedication and professionalism, which is why there are generations of JABSOM-trained physicians now who regard him as one of their most important teachers and mentors. His list of awards and accomplishments is long and impressive. Here are two of them. He was awarded the University of Hawaii Regent Medal for Excellence in Teaching. This recognized faculty who exhibit an extraordinary level of subject mastery and scholarship, teaching effectiveness and creativity, and personal values that benefit students. The Hawaii chapter of the American College of Physicians renamed its Excellence in Teaching Award to bear his name. Dean Jairus Hedges reflected, he is a skilled internist who has led the clinical skills program at the medical school for many years. A great many of the practitioners in Hawaii owe their clinical diagnostic skills to his mentorship. He is a classic gentleman who exudes respect and empathy for all whom he encounters. One prominent local physician, now retired, recalled his calm demeanor and patience and being among the best teachers she had at JABSOM. Think about that for a moment. His student is now retired, and he's still teaching. He has taught generations of medical students about clinical skills, professionalism, and the complex field of endocrinology. His enthusiasm for medicine is infectious. His steadfast and gentle example of how to be the ideal physician is one that so many of our students and alumni strive for. It is for his lifetime of selfless dedication to the betterment of the medical school that the Friends of the Medical School hereby bestow the honorary James S. Burns Award to Dr. John Mellish. I'm going to ask Jim's wife, Emmy, to join me now.
Thank you so much, Dr. Wong. On behalf of the Burns family, I just want to say a heartfelt mahalo for remembering Jim in this special way. As you know, he spent a lot of time here at the medical school. It was his mission to ensure that the school held up to its highest standards. So he wanted to make sure that everything went well. And it's just a privilege to know that you're remembering him in this really special manner. And I just want to also say that congratulations to the two people that you've selected for the James S. Burns Award for this year, 2020.
To our 2020 James S. Burns awardee, Dr. Patricia Blanchette
and Dr. John Mellish.
Congratulations.
Yes, congratulations to Dr. Blanchette and also to Dr. Mellish. The late Governor John A. Burns envisioned a graduate school of medicine that, along with the law school, would serve as flagships of a system of excellence at the University of Hawaii. The schools of medicine and law were considered cornerstones in the community's leadership, stewardship, and also sustainability. The medical school began during Governor Burns' third and final term. He was so proud of the medical school that he agreed to the use of the name by the school. His son, Judge James S. Burns, continued to see his father's dream come true and gave the class charge at the white coat ceremony for many, many years until his passing in 2017. At this time, I'm truly privileged to introduce Brendan Burns, the son of Judge James Burns and grandson of the late Governor Burns. Brendan Burns is carrying on the legacy of his father and grandfather. He will now give the charge to the class.
Aloha, class of 2024, e komo mai. Welcome. Congratulations, you are now part of the medical school's ohana. This is the beginning of a tremendous opportunity for you. You are now students at one of the finest medical schools in the world. It is an opportunity that many sought, but only you were chosen. In fulfillment of my grandfather, Governor Burns' vision, which he articulated during his administration, beginning in 1962 until he died in 1975, of the creation of a world-class medical school here in Hawaii, the John A. Burns School of Medicine, or JABSOM, as we know it, is a medical school that continues to make advancements towards a goal of po'okela, or excellence, since its founding in 1965. As we are currently in the midst of the COVID-19 global pandemic, his vision has taken on a whole new significance, as we have now clearly seen the importance of having one of our nation's top medical schools here in Hawaii in order to train the physicians of the future. JABSOM researchers, faculty members, and graduates are playing a significant role in Hawaii's response to the pandemic. In fact, at this very school, a SARS-CoV-2 vaccine is being developed by researchers, which has shown promise in preclinical trials. U.S. News and World Report recently ranked JABSOM as one of the best medical schools in America. Out of 185 universities nationwide, JABSOM was ranked in the top 1/3 in research and primary care, number 62 in research, and number 56 in primary care. Medical students of the class of 2024, now that you're joining such a wonderfully accomplished medical school, you're in a very select group of highly qualified students starting a long and difficult, but rewarding and satisfying journey to become doctors of medicine. What you do with this opportunity is entirely up to you. As you begin your journey, I would like to humbly share with you a charge for all of you to consider and to reflect upon. Just to be certain, I ask your family and friends who are watching to listen to this charge and maybe to even consider periodically reminding you of it. Students, as you hear my charge to you, and as I highlight important values and beliefs, which encompass your identity as medical students here at JABSOM, I would ask that you please keep in your minds the crucial question, who do I need to be in order to live out this charge? My first charge to you is I urge you to learn about all those who helped this medical school to exist and who are helping it to flourish. Recognize that the taxpayers of Hawaii are paying a substantial part of the cost of your medical education. Especially recognize those government officials who allocate those taxpayer dollars in support of it. Obtaining government funds is a never-ending struggle, especially when the demand for such funds greatly exceeds public revenues. Find out who are the true friends of JABSOM and provide them as much encouragement, support, and assistance as you possibly can. Publicize JABSOM wherever and whenever you can. Encourage others to become members of the Friends of the Medical School and to participate in its activities. Always remember that you are the best evidence of the quality of JABSOM's medical education. Second, I urge you to identify, appreciate, and personally thank each and every person who has helped you prepare for admission to this medical school. I'm speaking of family, friends, teachers, advisors, mentors, counselors, donors, and others. Some of them may be watching. Third, I urge you to get to know, appreciate, and personally thank each and every person and organization providing you with the finances to pay for your medical school education. If you are the recipient of financial assistance from a non-family source, take the time to educate yourself about the source of the funds and the reason the source provided the funds. If possible, personally thank the source of the funds and periodically keep that source informed about your progress. The UH Foundation staff who help solicit and administrate the JABSOM scholarships work hard to honor the many donors in our community who have great expectations for you. Please honor the donors and give back to the UH Foundation. Never forget that as members of the JABSOM Ohana, your future contributions to the school, whether they be financial or just simply volunteering your time to the school, will help those who follow in your footsteps. Fourth, take full advantage of the education offered to you by this medical school so that you will become and always be the very best doctor of medicine you can be in whatever area of practice you choose. Never stop learning. Remember the words of my grandfather, Governor John A. Burns, who said at his Hawaii State of the State address in 1966, "Greatness is your heritage, the pursuit of excellence, your means of attaining it. Let us not be content of anything short of the best." Fifth, do all you can to develop and improve your doctor-patient relationship skills and your bedside manner. Each of your patients is a unique person. Learn to listen, to understand, to be compassionate and empathetic in order to show that you are concerned and really care. Make it your goal to demonstrate this with a true spirit of aloha. 6, make it your goal to improve the quality of medical services provided by all other doctors of medicine, hospitals, and other healthcare providers here in Hawaii. You will be in a position to make a great impact in this area. Make it your goal to advance healthcare in Hawaii and the world by becoming a leader in society in the medical field. 7th, as JABSOM is a unique place, one with a rich multicultural and multi-ethnic environment being located in the middle of the Pacific Ocean, carry that spirit of aloha forward with you wherever you serve. I urge all of you, including our out-of-state students, to commit yourselves to providing the people of Hawaii and the Pacific with the kind of medical services they need and where they need it. Always recognize and appreciate the benefits afforded to you by your predecessors by contributing to the benefit of those who will follow you. Respond by doing all you can to provide the future generations with the opportunities present and the past generations have provided for you. This concludes my charge to you, which lays out a vision of who you can and will be as you embark on this worthwhile journey of becoming physicians. You now begin your long and difficult, but exciting, stimulating, and rewarding voyage to become doctors of medicine. All who are a part of your JABSOM Ohana look forward to being involved in your progress and your success. It is for you, with the help and support of your family and friends, to reflect upon what I have shared with you. To you and to your families, congratulations and aloha nui loa. And as my grandfather would often say at the end of his correspondences, warmest regards to you. Mahalo.
Thank you very much, Mr. Burns. I would like to take a moment to personally congratulate you, the class of 2024. In the daunting journey that lies ahead of you students in your quest to become healers, know that your future JABSOM mentors, leaders, teachers, many of whom are on Zoom with us right now, will be there for you every step of the way. Medicine is a family, and like a family member, your JABSOM mentors will stand by you and support you throughout your careers. We hope that you will look back fondly upon this day and upon a fulfilling and extraordinary career when you take the stage to cloak incoming JABSOM class of 2074. Congratulations, class of 2024, and welcome to the JABSOM Ohana. It has been an enormous honor to serve as your Master of Ceremonies this morning, and I thank you humbly. This concludes the white coat ceremony for the class of 2024. Aloha and mahalo, and stay safe, everybody.